How is aldosteronism-related hypertension diagnosed? Have you ever wondered how doctors figure out if someone has aldosteronism-related hypertension? This type of hypertension, also known as primary aldosteronism, is diagnosed through a series of tests that focus on specific hormones in the body. Let's break it down step by step. The first step in diagnosing this condition is a screening test called the plasma aldosterone-to-renin ratio. This test measures the level of aldosterone, a hormone that helps control blood pressure, in relation to renin, an enzyme that regulates aldosterone production. If the aldosterone level is high compared to renin, it may indicate that aldosterone is being produced independently, which is a key sign of primary aldosteronism. To get accurate results from the plasma aldosterone-to-renin ratio test, certain conditions need to be met. Ideally, the test should be done in the morning. Patients should avoid certain medications like beta blockers that can interfere with the results. It is also important to consider factors such as potassium levels and sodium intake, as these can affect hormone levels. For instance, if potassium levels are low, it can lower aldosterone levels and skew the results. If the plasma aldosterone-to-renin ratio is elevated but not conclusive, doctors will perform confirmatory tests. These tests are designed to show whether aldosterone secretion can be suppressed by sodium loading or other methods. Common confirmatory tests include the oral sodium loading test, where sodium intake is increased and aldosterone levels are measured. Another option is the saline infusion test, which involves giving an intravenous salt solution followed by measuring aldosterone levels. There is also the fludrocortisone suppression test, where a synthetic steroid is used to see if it can suppress aldosterone production. Lastly, the captopril challenge test involves giving an angiotensin-converting enzyme inhibitor to observe changes in aldosterone and renin levels. If aldosterone levels do not decrease during these tests, it confirms the diagnosis of primary aldosteronism. Once the biochemical tests confirm the diagnosis, imaging studies like computed tomography scans of the adrenal glands are conducted. This helps identify the underlying cause, which could be a benign tumor called an aldosterone-producing adenoma or bilateral adrenal hyperplasia, where both adrenal glands are overactive. Knowing the cause is essential for planning the right treatment. Clinically, aldosteronism-related hypertension often appears as resistant hypertension. This means the high blood pressure is challenging to control with standard medications. Some patients may also experience low potassium levels, but it is possible to have normal potassium despite having the condition. In summary, diagnosing aldosteronism-related hypertension involves several steps, starting with the plasma aldosterone-to-renin ratio, followed by confirmatory tests to check for inappropriate aldosterone secretion, and finally imaging to determine the cause. This thorough approach helps differentiate aldosteronism-related hypertension from other types of hypertension, guiding effective treatment options.